So welcome. We're glad you're here, and we're here to just share with each other, share the ideas that we have as opposed to any expert advice. So we're talking about keeping healthy in community. I'm Karen Gimnig. I am the Communications Director for the Cohousing Association, and this is a service of the Cohousing Association. So it's a free service, but it happens because of donations that are made to the association. Without those donations, we will not be able to continue to do things like this. So feel free to go to the website at any time, even right this minute if you want, and make a donation. And monthly donations that are recurring are particularly valuable to us. Karen Hoskin is also here. She's waving. She's our executive director. She keeps all the boxes added up and the columns where they need to be and keeps us organized pretty well, as much as anyone could keep us all organized. So to get into the topic of the night, you know, the coronavirus stuff has just gotten more and more in the news, as I know you all are aware. And we've been talking about it at the association and how can we help support communities, and communities have been asking us what do we have to offer help with. And one thing we're really clear about is we are not doctors or public health officials. So we are not giving medical advice. We're not telling people what they should or shouldn't do. And we're also not the co-housing police. We're not going to tell you co-housing communities must. Really our function in the movement is to bring people together and share information, and that's what we're going to do tonight, is give you an opportunity to talk to each other. So I don't have much to say in terms of what to do. A few people emailed me things that I'll throw in at some point. Hey, I can't be there tonight, but include this. I got a couple of those emails, so I will share some of that. But for the most part, this is an opportunity for you all to talk to each other and learn from each other and just share ideas. Much more that than any sort of definitive this is the best way, because what we really think is we actually don't know that, right? As is often the case in group work, we don't know that. There we go. So I want to talk about three sort of categories of things, and if you have additional categories, by all means put them in the chat, but I'm going to try to focus us a little bit into categories. So the first thing I want to talk about is, I think, what people are mostly working on at the moment, which is preventive measures. What are we doing that is different than what we would normally do to try to avoid the spread of coronavirus or avoid people getting it? And recognizing that every community is going to have their own threshold, their own level of concern. Probably within every community, there's a range of people who are very concerned and people who are less concerned. So we'll talk about prevention just as a sharing of ideas. I want to avoid too much of the everybody ought to kind of approach, and more of the here's a bunch of ideas and something you might try. I thought we'd talk about any particular care or concern that we're giving relative to susceptible people, right? So we have sort of the everyday stuff. Are there special things that we're doing for people who are particularly concerned? So we'll do that topic second. The third topic is, what plans do we have for when people get sick, or if anyone has a community where somebody's already sick and has something to say about that. But I imagine for most of us, we're in the planning stages, I hope, of how to be prepared for when people get sick and what do we plan to do about that. And the fourth topic I have in mind for tonight is about kids. And with kids in communities, if schools get canceled, things of that nature, are there plans to do something for children, or particularly around children who might have a harder time being isolated from their friends and so on. So kind of what are the thoughts about that? So those are the topics we'll start with, and put things in the chat. If I see more requests, I certainly will add them as best I can. And we're going to see how this goes with now 85 of us on the call. So glad everybody's here. And I'm just going to open up that first topic, which was, what are the preventive measures that people are taking? And if you have one, I'd say put it in the chat and I'll sort of read them out. And if you want to say something about it, feel free to unmute yourself. And
I think that the raise hand function might be working.
Yeah, I just put an instruction into the chat. If you click on participants, and there is a raise hand button in that list on the lower right. and I just used it because you noticed I raised my hand. The
Awesome.
one thing I want to mention when I raise my hand, aside from that the raise my hand symbol is there, is that Patty Lautner of our co-housing group, JP Co-housing, sent a spreadsheet to the to the listserv Co-housing L, and Fred put it in. You can't put attachments there, so Fred put it in a area where you can click on for attachments and you can bring it up. What it is kind of having 6 scenarios from scenario least to most of what one would do if that scenario functioned. And I'll just say, take a look at it. It can be informative. But if somebody has questions on it, raise it to me and I can answer or let Patty know. But I wanted to let you know that Patty sent it. It's there. It's a spreadsheet we've come up with.
Okay. So folks are beginning to figure out how to raise their hands, I see. Thank you, David. And Phoenix Commons from Oakland. I'm not hearing you yet. You may need to unmute yourself.
All right, actually, I was just testing the raise hand sign, but can you hear me?
Again.
So there are several things we've been doing for preventive measures. We have stopped having events with people from the outside here. We've put signs up at our entrance where visitors are not, for individuals, bring the building if they're sick and they should call their person instead. We have initiated hand washing requests, and when anybody comes down to our common space, they're washing their hands beforehand. We've done spacing at our community dinners, so people aren't too close together. There are other people here. Somebody want to add to some of those things?
We have hand sanitizers at the front door for delivery people. What else?
And we are planning on doing more disinfecting of common things that are getting touched, like handles and all of that.
In our common meals, we are having for our salad bowls, a salad bar. People use their own individual spoons rather than a common spoon for people to help themselves to condiments and salad fixings. And we also have our main cooks and our assistant cooks serve the folks as opposed to people helping themselves. So there is just one person. And we also have people who set up, wash their hands before they set up, as well as people who put the clean dishes away, make sure they wash their hands before they put the clean dishes and utensils away.
So we live in a building with 41 condos, and we have a whole floor of common space on the first floor.
Great. Okay, so lots of good ideas there, including a lot about common meals. Another one that I got by email that I can't remember who it was that wanted it to be shared was a thought about when you're serving a common meal, not to put the individual dish over the other. Like we tend to sort of hold our dish over the pot so that if any drips go back into the pot. And she was saying that that creates the potential for also germs to fall off of your own dish and into the pot. And so of holding your personal dish not over the pot and recognizing that it's better to be wiping up spills than to be dribbling germs into a common pot. So that was another suggestion along that line. I do see a couple of hands raised. I want to just catch us up with what's in the chat as well. So in Casa Verde Cohousing in Colorado Springs, we have suspended meals for 2 months and we'll reassess. We have also suspended group meetings over 10 people in the common house. We're looking at options for our upcoming community meetings. Probably will just Zoom. So thank you to Michelle for that. John Goldberg is saying we're talking about having designated food servers at common meals rather than everyone holding the serving spoon. So that sounds similar to what Phoenix Commons was talking about. Mike Salma of a forming group in Puyallup, Washington is asking any ideas how to form a core group without physical meetings. So I'll hold that one for a second. Just keep reading. All right. Lori, or Lois rather, I think you have your hand up.
Hi, no, I was just testing.
Just testing. Okay, I will take your hand back down. And Margaret Porter looked like had a hand up.
Yes, I'm at Silver Sage. We are a senior co-housing community, and therefore we've been in conversation about, we have people who are immunocompromised. We are on a whole range of risk averse to risk tolerant, depending on life experience and our individual health situations. We have not suspended common meals. We don't cook together. We do a potluck function. We have so far let just individuals decide, for example, if they have been traveling, whether they're going to self-isolate or not. We're having our first community meeting by Zoom on Sunday to talk about whether we should develop a common approach to outside visitors. We make our common house available extensively for outside activities, and we know we need to decide as a community whether we're going to restrict those activities or not. We also have boxes of gloves and Purell scattered around the community. I really like the idea of actually having it at the front door for delivery people. We do have a professional nurse in our community, and she has been very helpful in terms of circulating information on various aspects of COVID-19 and encouraging us to think really carefully, particularly if we've been traveling. So that's what we're doing so far.
Great. Thanks, Margaret. Sounds like a lot of great ideas. So I know we've had a handful more join since we said this initially. If you would like to speak, you can raise your hand through the participants section. So if you go to the bottom and click participants, and then there's a raise hand button option. So you can raise your hand. You can also put things in the chat. I see Jamie had asked about how to access the spreadsheet, and take a look in the chat. I believe that's probably what Eva then posted, was the link to that. And then a comment that if March Madness and other sports events have been canceled, we as co-housing participants could just not have common meals. I want to revisit the question from the forming group in Puyallup about how to gather a group without physical meetings. And certainly there are lots of groups who, for any number of reasons, have been doing Zoom info meetings. There are lots of ways to do that. There's also a slideshow available on the website at cohousing.org/marketing that you could use for those Zoom meetings if you're, or for live ones, either one. But it certainly is possible to use the Zoom function for that. And if there are other ideas for him, feel free to raise your hand or to just put it in the chat of thoughts of how to gather a group without physical meetings. Someone's asking, is anyone able to obtain test kits? Anything about that? David in Jamaica Plain, and then Jeff, I see your hand.
Actually, this is a reply, since you mentioned somebody talking about March Madness being canceled would imply not having common meals. And I wanted to mention March Madness would have had thousands of people exposed, or tens of thousands. Our common meals are like 20 or 30. So March Madness being canceled, that doesn't imply anything for our common meals. We don't attract 10,000 to them.
But we will one day, right?
Yeah.
Yeah, thank you for that. Jeff Brown, I see your hand.
Sorry, Karen, can I just tag on to that really quick?
Yeah.
So we don't typically attract thousands at National Co-Housing Open House Day, but it can certainly be in the dozens, or maybe if you're quite successful marketing, hundreds. There will be a web chat a week from tonight where we will be discussing how your community can participate in the National Co-Housing Open House Day without literally welcoming 100 people with dirty hands in.
Or even
So
100
stay
people who
tuned
think
for
their
that.
hands are clean. Yep.
Yes, so
Yep.
stay tuned for that. And then, sorry, go ahead, back to.
Yep, same time, same channel, same link even is what you did tonight. So we'd love to have you back. Jeff, I saw a hand.
Yes, this is actually Eco Village at Ithaca. This is Sharon, who.
Hi, Sharon.
Hi, thanks for doing this. We have a task force here, and we're working through the issues and to support our community in the face of preparing for the impact of coronavirus. We're a little stuck on cleaning products because we have folks who are sensitive to different chemicals. In particular, bleach is a problem. And many of the chemicals that have been recommended so far for cleaning do a great job of killing the virus, but they are toxic to folks who have chemical sensitivity. So I'm wondering if your communities have found any solutions for this puzzle.
Great. So there are a few things in the chat around that. So see CDC materials for ideas. And then someone saying, very cautious to offer advice. Oh, that's, yes, Karen. So we want to be very careful as an association not to be.
I hear the question a little bit differently though. My understanding, without looking at current guidelines from CDC, knowing CDC, the cleaning agents that they often recommend can be hard for somebody with multiple chemical sensitivities. I think your question is what are other communities doing if they want to follow the guidelines, but those particular cleaning agents are hard for somebody that has MCS?
Yep. So I'm just scanning the chat here because I've gotten behind.
And I have not looked at CDC in the last 3 days. Often they do have some recommendations of something that does not have, it's not a bleach base or not a, doesn't have fragrance. So I would recommend looking at CDC guidelines first to see if they have anything that would be acceptable to somebody that has MCS or sensitivities.
Yep. And Jim in the chat is saying what I also heard, which is alcohol. He's saying 60% minimum. So I can't speak to that number, but alcohol I've seen in a number of places and recipes out. I've also read, and again, I can't verify this, but I have read that vinegar, unfortunately, is not effective to kill the virus. But again, the recommendation to check in with CDC, who are going to know, yeah, that's where you want to get your medical advice from. Phoenix Commons, you've had your hands up for a bit.
That there, at least in our community here in Oakland, I think throughout the country, kits are not readily available. The government's been responding very slowly in getting kits out to communities. But if someone needs a test, what I would say they should need to do is call their healthcare provider and find out. Again, at least here, your doctor has to order the test for it to happen. And they're using them primarily for people most at risk or people seriously ill. So those are, people been traveling or being in contact with somebody who's known to have the COVID virus. So if people are more concerned about that, I would say check with your healthcare provider and find out what the situation is where you are.
Great. So I think that was the response to the question in the chat about getting test kits. But I've also been hearing that those are in limited supply, and that because they're in limited supply, they're being pretty careful about who gets them. I also understand that that varies a lot state to state. So you may want to check both sort of with your provider and with state agencies. My guess is you're going to get different answers in different places on that one. Vicki, I see a hand. Vicki, I'm not hearing you yet. You may need to unmute.
Unmute. My apologies.
There you go.
I live in Western Mass in Pioneer Valley Cohousing, and I am a pediatrician. And it is shocking how unavailable tests are. That, you know, we've been told they're available at the hospital, but we just had a meeting with the head of the emergency room, and they're not available. They're testing, that's in quotes, but they're not getting results back. They're testing for every other virus under the sun, and they, you know, they think in another 2 weeks there'll be more tests available, and it probably does really differ by community, but it is very hard to get tests unless you're getting admitted to the ICU. Just saying.
I appreciate that look from within the healthcare world. Thanks for speaking up. And Karen, I see you have something to add to that.
Yeah, actually not add. I just want to make sure that we circle back and get on track about dealing with this virus in relation to community. And I received one email question earlier, and the question was in relation to community, if schools are being closed, yet they don't get a vacation. They're supposed to
hold on, Karen, because I had laid out a set of 4. We're going to get to that one.
Okay.
But let's, but I think that's right. So I think we've done a lot about the prevention piece. And the second piece I said we'd get to was for susceptible people. Are there particular things that we're doing in community, knowing that we have some folks who are especially susceptible? Are there mechanisms or things that you're trying to take care of those folks? And I do see a couple of hands. Patty.
Okay, sorry, I was on mute.
Yep.
You can hear me now?
I can.
Oh, good. So I'm in Durham, Central Park Co-Housing in Durham, North Carolina. And the state has declared a state of emergency. I just did a trip to New York City and was very aware of the rapidly changing conditions in just days, from 1 to 6 to 142 to a state of emergency. And here where we are, I'm just like wondering if the conversation is focused on what co-housing groups are doing, you know, to get together and institute whatever protocols that they think might help to protect the communities that they're in. So we are pretty much senior co-housing here, probably average age over somewhere in the 70s. And we had a house concert planned, we had a retreat planned, we had a conflict and communication workshop planned. We're now implementing protocols to limit the amount of outside visitors, putting sanitizers readily available at the entrances, and we're an urban co-housing, so it's different than single family homes.
Great, thanks for keeping us informed of what you're doing. That all sounds great. I want to catch a few things in the chat. So on this question of what are we doing for those who might be particularly susceptible, Kat says one man was tested and that he'd been exposed, and during his quarantine at home, his wife, who's immunocompromised, stayed at another member's house. So that was something that was done for someone who was particularly susceptible. Making sure that they have Skype and Zoom capabilities if they're self-isolated due to their age or susceptibility. Thinking about offering shopping or errands for these folks. Washing hands is talked about widely. What about frequently washing one's face? Question. And Susan Green, I see you asking how you show that you raise your hand, and you can do that through the participants list. But I also can just call on you since you let me know in the chat. So Susan, what would you want to offer? Let me unmute you real quick. Oh, you have to unmute yourself. You have yourself on mute.
Okay.
There you go.
A public health friend of mine recommended taking our temperatures daily, and that if you had a temperature above, I think he said 99.8, you shouldn't be around other people. I haven't seen this anyplace else, but I'm wondering, that's a way for people to make sure that they can be around somebody who has fragility, and for that person as well.
So taking temperatures is a way to just make sure that if you're trying to care for someone who has fragility, that it's a protective measure you can take just to make sure you know. Yeah.
So does anybody know if that's actually, that's a question I have.
Of whether that actually helps to take your temperature?
Yeah, is that something that should be a regular practice at this time?
It certainly wouldn't hurt, I think.
CDC guidelines.
Thank
Go
you.
ahead, Karen.
Well, I've looked and I didn't see that specific thing, but
That's the protocol they're using.
I know my housemates has a child who lives in, an adult child who lives in China. And they, for a while, were quarantined, and they would have specific permissions of when they could leave their house to do things like get groceries. And they took their temperature on their way out the building, and they took their temperature again on the way back into the building.
Exactly.
There was lots and lots of temperature taking. Whether that means it works or not, I don't know. But that's not a unique idea. That's certainly out there and has been done. We have more hands raised. Eva has been waiting patiently for a while.
Hi, thanks. Yeah, I live at Rocky Hill Co-Housing in Western Massachusetts. And one of the things that I've been thinking about a lot that isn't part of your general agenda here, but I think might be worth discussing, is the mental health impacts of everything that are going on, the collective anxiety, the individual anxiety, the isolation that people might start feeling, because it seems like as we're particularly poised to actually support each other much better in that. And how can we, not lose the strengths of our community and support each other while still, keeping healthy and keeping safe?
Right. So that challenge of looking at the mental health challenges and what isolation does with that, and what can we do to keep the social connections in light of the recommendations for our health to be separated. I think that's an excellent question. If people want to, someone in the chat is saying, yes, I like your statements very much. I'll also say that I've been reading studies that say that your immune system is actually suppressed by anxiety and fear. So this is a good time to avoid scary movies and watch warm and fuzzy ones. And anything that keeps you sort of calm and happy is helpful for an immune system. So I think that relates to what you're saying, Eva, of even keeping that social connection happening may even help us avoid physically getting sick, in addition to the mental pieces. Dory has a hand up.
Okay, now I'm unmuted.
You are.
I am at New Benusset Neighborhood and Farm in Peterborough, New Hampshire. And we actually just had a meeting like right before this web chat to begin the conversation. And one of the things that people offered, like some of the younger folks in our community, this would just be for like the true intergenerational communities. They are stepping up and offering to get anything for any of us, like groceries or anything, because they are less at risk of having severe cases of it.
Nice.
And I'm trying to remember, there was something else I was going to say about how we are helping with, oh, we've also thought about getting a Zoom account for the community so that we can be talking to each other without having to be in each other's presence. So kind of addressing the social isolation.
Yeah, so having a basic Zoom account, and Karen's putting in the chat that a basic Zoom account is free, and one of the limitations on that is a 40-minute meeting time. But even
But
the one that
sorry,
even the one that we're using right now, that as we see can accommodate plenty of people, is $15 a month.
Right.
And I certainly have known communities that had particularly forming communities where they don't have a common house and said, okay, well, Zoom is going to be our common house. Anytime you want to go there, you know, just everybody has the meeting ID. And if you want to show up there, see who's there, you're welcome to do that. So that certainly can happen. And yeah, and so someone else commenting that the free version does have some limitations. So there was a question or a comment someone on the chat a while back about doing common meals by Zoom, and we'd love to hear how that works, if we can get a little more detail about how that happens.
I think that was Daisy.
Daisy, are you still with us?
Yes, actually. We're just scheduling them. So we're going to see how that goes. For one-on-one, you can actually regularly check in with neighbors, regularly check in with anybody in the community and say, oh, let's have dinner. We'll eat our food, you'll eat yours. It can be silly and playful, and you're sharing, you know, what you're eating, and you're talking about whatever you want to talk about. So you can actually check in with each neighbor. It's a matter of not changing what you do, just changing how you do it. So we'll still be interconnecting. It might be different with a larger group having a dinner, but it'll be like this, but everybody's got a bowl in front of them. And, you know, somebody says, well, I just have this great soup, or I just pulled something out. And then you're still having these conversations. And it ends up being people chatting on the side, or people talking together one-on-one. And for Skype, you can do it regularly, you know, with every neighbor that you're concerned about on a regular basis. And it keeps, it really affects the immune system, because you get the, you know, the same effect as if you were getting together in a common house. But without the virus.
But without the virus.
That's off the menu.
Virus off the menu. I love that. Barb, you have had your hand up for a while. Barb at Pioneer Valley.
Hi. Yeah, we have a small group of 6 people who are starting to sort of brainstorm how to approach all this. And one of the ideas that we came up with was to separate the community up into smaller support groups, basically proximity. So units 1 through 4, 5 through 8, so on and so on. And that those clusters of people would be one another's support. And that you decide how you're going to check in every day, whether it's over the phone or over Zoom or whatever works for y'all. I love this idea of doing Zoom meals, and I'll bring that back to the community, saying maybe those support groups may want to once or twice a week arrange to have Zoom meals together. And we've also asked that if anybody does get sick, that they just let the community know over our listserv, so that we know who we need to be keeping an eye out on, and if there's somebody who might need extra support.
Great, thanks, Barb. So I want to shift the focus to the third topic, which was what plans are in place for what happens when somebody gets sick, for supporting them, for what is your community thinking you're going to do when that happens, or if, I hope it's not, but if somebody in your community is already sick with it, what are you already doing? Other thoughts? Well, hopefully this means that we aren't sick yet. We haven't started implementing things. I know one group shared that they were sort of setting up a spreadsheet where people who were not sick could list sort of their willingness to help with things, but particularly people who were sick or just needed to isolate or whatever their need was, where they could post a need. So there was just a shared Google spreadsheet being used for that. So that's one idea that's out there in terms of being able to support without having to be physically in the same space with someone who might be ill. Other suggestions or thoughts about how to support folks who are ill? Oh, Janet of Quimper Village has a hand up. Oh, I see more coming. Good.
Hello, we're a senior co-housing group, and we have 2 individuals who are ill. One of them has tested, but does not have the results. The results were supposed to come out today, but they are delayed. But due to these 2 situations, we have decided to virtually close the common house to try and keep all of us as healthy as possible. You know, this was just announced yesterday, so we did not have our general meeting today, and our common meals are canceled at this point. I like the idea of doing common meals by Zoom. We can pick that up. As far as helping them, we've all offered to run errands, buy groceries, pick up meds, but at this point they're self-sufficient, and we're just biding our time, seeing what's going to happen. We're outside Seattle, and a lot of us have connections with Seattle, so it is expected that our community will have the virus very soon, if it's not here right now. They've run 56 tests, and 19 have come back negative, 1 positive, but quite a few of these are just stuck in pending. So we're at a lack of information at this point.
So lack of information. And again, those preventive measures, and then anyone who is sick, you may not know whether it's coronavirus. And I saw someone in the chat was saying that a child is sick, and they're just putting a note on the door so that everybody knows and the kids don't come knocking trying to play. And they don't know whether it's coronavirus or just sick as kids get sick. So love and hugs to your community, someone's saying. Susan, I see your hand up. Susan Greenadaria. Susan, I'm not, oh, Susan, you need to unmute, please.
Okay. Janet just said most of the ideas that we've been using all along for when neighbors are sick or have had surgery. We're reaching out to them and no one has been diagnosed here at ARIA, but I'm sure we would be doing the same things.
Great, thank you. Phoenix Common. What?
Comment.
I didn't hear you, Karen.
Vicky Wasson has a question or comment. She can't figure out how to raise her hand.
Yep, I'll get it. I'm going to get Phoenix first, and then yes, we'll get to Vicky.
So this is Dawn again from Phoenix Commons. I didn't mention earlier we are a senior co-housing, also urban, and well, part of what we've done actually is in the prevention part too. We've asked everybody to be sure they have at least enough food and medicines, both prescription and over-the-counter medicines that they might use for at least 2 weeks. They'll order them from their doctors if need be. We've formed a committee between the wellness, our wellness committee and disaster committee, that's an ad hoc group that's overlooking this and meeting with the community on a regular basis to get everybody's concerns and ideas. And we do have a circle of caring here that's already been established to help people out who need it or are feeling isolated. And some of the things other people have mentioned, we just have it as part of what we do to check in on people if we're concerned about them at all, to ask folks to let us know. We have a common website, if they're an email list, if they're feeling ill, so we can follow up with them, that we can bring food to people if they need it. And we are, I mentioned earlier, keeping social interactions at a minimum outside the community. Anything else? Oh, okay, I think that. The other thing I don't think I've actually heard mentioned in here is that we're reminding people if they cough or sneeze, they should not only should they remove themselves from the group, but they should do that into a tissue that they then toss away and wash their hands, and or to do it into their sleeve if they're not using a tissue. I know that's getting mixed up with prevention, but that's all part of it. But I had somebody mentioned before about isolating, if it's two people living in a place, isolating one if they're immunocompromised. But it made me think of something we have here, which is a guest suite with a couple separate rooms that we're going to discuss whether or not we should not allow any further guests in at this time, and maybe that room could be a room if couples had to separate.
Great ideas. And I see many more hands coming. Let's get Vicki next from which one? Wasatch, I think. Yeah, Vicki.
Hello, can you hear me?
Yeah.
I don't have my face on, but I'll just tell you what we did on Wednesday for our ACM. It was just this weekend, and we moved into a larger room so we didn't have to be as close to each other. And then there was one person who wanted to participate, and we used a very simple way because we're not quite up to Zoom right now. I'm the one that also needs you to tell me how to raise my hand. But so what she did was one person they just used their iPhone. So she just called, and he left the iPhone on for 2 hours during the meeting, and the speaker was good enough, and she could hear what was happening. And when it was time to vote, they said to her, okay, what do you think? And she did a thumbs up, and so she could participate. But Zoom is wonderful, but now you can maybe tell me how to raise my hand.
Yeah, I put a note in the chat for you about that one, Vicki.
All right,
so
thank
hopefully
you.
You can see it. Great.
And hugs to everybody. This is a special time for all of us, and we'll be better as a community if we stay calm and do these things. So thank you so much.
Thank you. Glad you're here. I see 4 more hands, so we'll do those. And then I do want to move on to the topic of kids and school closures and that sort of thing. But we'll go first to Patricia and then Gray Rock next.
So I'm in Pleasant Hill, and we're having a meeting tonight to make decisions about communication and groupings in the Common House, and for the foreseeable future while this is going on. And I came late, about 15 minutes late, so I missed the discussion on the common meals. And that's a really critical thing we're going to be deciding tonight in a couple hours. So I'm getting the feeling from what I'm hearing so far that people in all the different communities are canceling them, except for Zoom meetings.
I would say that is not a consensus, that there are communities still holding common meals, and that they're letting the sort of individuals choose how much to participate, and they're spreading out more, and they're doing various things. So you might want to just listen to the recording when it goes up in a couple of days. There were lots of suggestions from communities that we're going to continue with common meals.
Yeah, so there was a strong, there was no decision, no consensus on this at all.
No consensus. Who'd have thought? 100 people on a call and you wouldn't get consensus right off the bat. Yeah. Fortunately, we don't have to. It's just all about sharing ideas. Gray Rock Commons, I see a hand.
Hi, this is Shannon. I just learned of a resource that our health system here has today, or I just learned today. It's called UC Health, and they're doing telehealth. So if people are feeling sick and want a physician or a provider interaction, you can schedule through telehealth, and you don't have to go in, and it's through their urgent care system. And I thought that's a great idea because some people need tests, some don't. But it was an option.
There's probably other communities.
What?
Probably other communities that might offer the same service.
Yeah, probably others offer that too. Or
Great, thank you. Yeah, there's a lot of telephone health out there already, and I think they're expanding it with this because they don't want people coming in when they feel sick.
Yeah, and it's not telephone, it's like a Zoom
Video.
or,
Sure.
yeah.
Great. So look for that in your communities. Pat, I saw a hand up. Pat in Linden Cohousing.
Hi, this is Pat, Linden Cohousing, a new cohousing community in the last 4 months, and so we're learning a lot as we go along. One of our earlier discussions, and it's come up again, is do we have emergency contact information on each member, and how do you keep that, and how the privacy? So this situation may spear those conversations to be a little more clear on what people's needs are, how much medical information they wish to share, how do you keep that safe. But there's a safety group here. That's probably one of our topics that we'll be having to bring back to the community in the next week.
Great, thanks for that. I want to move us towards 2 more topics in just these last 10 minutes. One is the kids. What are we doing about kids and potential school closures? And then the other was one that came out of the chat, which was about laundry. And, you know, if common houses are closing or if people are sick, are there any sort of provisions being made for laundry, particularly for folks who typically would be doing their laundry in a common house laundry? So pointing us in that direction, and Patty, I do see your hand is up. And Patty, if you'll unmute, please. Oh, I think I got you. There you go. You're on. Oh, there we go.
Okay.
We can hear you.
I really, in terms of laundry, we share laundry facilities, and we've implemented a lot of sanitizing measures. And there is a state of emergency in North Carolina. So, but I'm sorry, I wasn't quite ready to move on to the children. I think that how we're handling the level of anxiety and, you know, concern and compassion that we have for one another, how do we stay connected when we might need to be physically apart? It seems to be such an important thing, because people want face-to-face contact, and I believe that's been privileged in co-housing. Like, we do know the value of it. We really know it. And now we're having to find new ways. And I think Zoom, other things are unfamiliar. So I've been so appreciative of all the people who have shared things that are working. And anyway, we're just trying to stay safe here.
Yeah. So concerns about again, that sort of need for connection and what happens with that. Yeah. So someone said in the chat, hopefully another web chat will expand on the topic of the emotional aspect of this. And you were reading my mind. What can I say? So Karen and I'll figure that out. But please watch your email. We're using our large group email more at the moment to try and get messages out about this, because we're planning things to, you know, like as they come to us as quickly as we can get them put together. So be forgiving of your inboxes being full and look for next messages, but I'm having that same sense, and I'm seeing Karen smile at me. So I think odds are you'll see another web chat scheduled in the near future to focus on that particular thing and maybe updates of what's going on with folks. Anyone have thoughts about kids and school closures and that sort of thing? Not yet. That we may get more as it happens. Karen, go ahead.
So our schools are likely to be closed down, but the kids still have work to do. They're still expected to do their school work. And so it came up with a couple of my neighbors talking the other day about should we host the gathering of kids at the common house to just kind of be there and make sure that they're not dorking around, that they're doing their schoolwork. They can, you know, many kids do have computers through school or on their own. And so I guess my question at first, I was like, oh, that's a great idea. And then I was like, oh, but wait, that's a collection of people, which we're not supposed to be next to each other. So I was just curious if anybody else's communities had a conversation about that.
Daisy, I see your hand up.
Yes. Now we haven't created something with the kids yet. Khan Academy is renowned tutoring and free online classes and tutoring that kids can actually. They've actually there've been whole organizations and whole sections of the country that have taken on Khan Academy as their schoolwork, and then kids go to school and do the homework. So it's kind of reversed. It's extremely healthy for kids of all ages. But I have a whole list of things that people of all ages can engage in addition to engaging with each other: exercises, breathing, Coursera, which is college courses. So there are a lot of these things that can engage the family together and the kids for anybody who's stuck at home for any reason. The Khan Academy is a big award winner.
That's great. Thank you. Karen, did I see you?
I was just going to say again, I feel confident in our school district. We're blessed that they're good. I feel confident that the kids will have structure of what needs to be done. I guess my question was more, should they gather together? Because some parents are also blessed enough to be able to then do their work at home, which is challenging if there's also kids there. Like, should we make a little like old-fashioned schoolhouse kind of thing?
And I imagine that you'll again have that sort of range of responses of folks, and particularly in light of the predictions that that while children certainly can get sick, they're unlikely to have as severe a consequence of the illness as the elderly or those who are at risk for other reasons. So I'm sure that all of that complicates the question, I imagine. But I think it's great to be thinking about it and talking about it, because what I will say we know about communities is that if we can talk about things early and often, the odds of getting through in a way that works for us is better. And I'm going to take time for one more comment from David, who has a hand raised, and then I will wrap us up.
Yeah, I was wondering in terms of kids and so on. Well, I mean, there are these special things, but what about plain and ordinary Facebook? I don't know how to pull a Facebook group together, but I'm sure the kids know, and they could organize a face group of their friends and get together for schoolwork that way.
That's a great idea.
It's a great idea, all except the Facebook part, because anyone with kids will tell you that Facebook's for old people like me.
FaceTime, like on Zoom or Skype.
They have other plans and other ways.
Oh, whatever they use these days.
Right. I just have to laugh. How quickly things change. So, well, thank you, everyone. I feel like there's been so much great information. I'm going to have to listen to the recording again to capture it all. And I'm going to do my best to get the chat also into a document, because there was a ton of information there, some of which we read out and some of which we did not. So assuming I'm successful in that, that document also will be linked. The place that you want to look for that is on our website at cohousing.org/past-web-chat, or just cohousing.org/webchats, and then it'll link to the past web chats page, or cohousing.org, scroll to the bottom, and you can find the word web chats in the footer. So we try to make it as easy as possible. You can go there right now and watch 41 other web chats. If you want to watch this one, you're going to have to wait a day or two until I get it processed, but it will be there. And look for announcements of additional meetings like this. One thing that I'm getting the sense is that even if we don't have brand new fabulous answers, the opportunity to just come together and have the conversation is worthwhile. And I do think that a conversation specifically focused on the emotional impact is wanted. And I think we can try and get that scheduled in the near future. While you're on the website, don't forget to use the donate button. It is very much the donations that we get that make these sorts of events possible. We very much appreciate them. And it keeps the Cohousing Association in business doing this sort of thing when there's times of crisis, and also the day-to-day kinds of things that we do to help forming communities form and the co-housing movement continue to make the world a better place in all the ways that it does. Karen, is there anything else I should be saying by way of wrap up?
not wrap up. I just want to say I'm really happy that I'm a part of a community because I'm confident that we can rally around each other and support each other.
Yep.
Very happy.
Stay healthy, my friends.
Stay healthy, everybody. I do
Stay
see Franny had a hand up. Do you have just a very quick thing before we close in our last minute? And you are muted, Franny, so we're not hearing you. So you're not muted, but your voice is not coming through very well. Do you want to try again?
Oh, yes. Wait, how's this? Is this better?
Better.
I was asking, and maybe somebody said this when you were talking about what to do with kids being at home and also just the isolation. Isn't walking around outside together okay? And how much is it okay?
So again, we'll refer you to CDC guidelines and such for that sort of thing. I think it has to do with how much you touch and how close you are, but I would imagine being out of doors is at least less shared air.
So that's
Someone
an advantage
asked,
of being in co-housing.
exactly.
Because we
All
have
right.
proximity, but outside.
I do want to close us up, but my favorite question of the night might be someone saying, where is the donate button? If you go to cohousing.org, you have to go to the website. Unfortunately, we don't have a way to give you a donate button on Zoom, although I bet Karin
put in the link.
chat.
I put in the link in the chat.
But cohousing.org, if you just look at the very top of the website in the header, there's a donate button. And I think we have one in the footer at the bottom of the page
We
too.
do.
So yes, thank you so much. We really appreciate the donations that keep us in business.
Karen, remember to save the chat.
Yep.
Yep. All over it. And we'll see you guys next week for part 2 of this conversation.
Part 2 will be the how to do an open house in this set of conditions. So look for that. We'll look to save the chat. Dean, I do see your Sunnyside hand up. Did you have a quick question?
Just a comment. At trying times like this, there are often tremendous opportunities. And we need to keep our eye open for things like that. Like
absolutely.
What doesn't kill us makes us stronger.
That's right.
That's right.
Thank you, Dean. What a great final thought for our evening. So thanks everybody for being here. Our most populated web chat ever.
Woohoo.
Good to see everybody.